Working Group for Risk Communication and Community Engagement. My co-moderator, as usual, is Tole Nayata. Tole is an Internews pandemic media mentor, and he's based in Nairobi. Our goal with these dialogues is to provide you, the journalists, with newsy news in serving your audiences with COVID-19 information. Last month, WHO epidemiologists took us through some of the possible directions the pandemic could take us from here as we need to get this under control and get on the right track in East and Southern Africa. In today's dialogue, we'll get an update on the current situation with COVID globally and take a specific look at the state of COVID vaccination in Africa. And we'll also look at how misinformation about COVID threatens to undermine public health efforts to address other outbreaks and other diseases. We are joined today by Antoinette Eleanor Ba, the East and Southern Africa Regional Immunization Coordinator with UNICEF, and by Anne Gungare, a social content editor with Viral Facts Africa. Our main purpose, as always, is to answer your questions. So please, as the speakers are going, feel free, type in any question in the chat box, and Tole will monitor that chat box, and we will share those questions with the speakers during this dialogue. But first, before we turn to our speakers, we want to take a look at what people in the East and Southern Africa region are currently saying about the pandemic. It's important for us to know what people are saying about COVID in order to know where to focus our communications efforts. So my co-moderator, Tole Nayata, will take us through this month's community feedback. Tole?
Thank you very much. Thank you, Wayne. So I'm going to take you through the last community feedback, which came out of the feedback sub-working group of the RCCE of the Eastern region. And this particular one was compiled by 5 members: the Apostolic Women Empowerment Trust, Christian Care, UNICEF, WHO, and IFRC. And they picked concerns and issues from 11 countries, and we'll be looking at what they were. They were categorized in 2, and the concerns were one about the COVID-19 vaccines, which were had in 7 countries and picked up by 5 partners. And there was enforcement of preventive measures, which was had in 7 countries by 3 partners. So with regards to the first concerns, some of the themes that were picked in 7 countries by 5 partners included questions and concerns about the vaccine side effect or the risk to health. This was had in 4 countries: Kenya, South Africa, Tanzania, and Uganda. Concerns related to forced vaccinations in schools was had in 2 countries, that is Kenya and Southern Sudan. Concerns about vaccine shortages was had in 4 countries, Kenya, Southern Sudan, Tanzania, and Zimbabwe. So a few of the issues that came from the region include, but not limited to, questions about if the COVID-19 vaccine is dangerous to pregnant women, and if it should be prescribed to pregnant women, and what can happen or what will happen to pregnant women if they get immunized. These concerns were had in Kenya, Southern Sudan, Tanzania, Uganda, and they were picked by WHO. There was a fear. Somebody was saying, I'm afraid of taking my 2nd dose because of the side effects of the 1st dose. This was an issue which was picked by IFRC in Kenya. The issues it was with regards to vaccination in schools. The question, there was a parent who was asking, why are schools vaccinating students without parental consent? This was had in Kenya and South Africa. It was picked by UNICEF. And also there was a concern in Kenya. Somebody asked if it's a crime not to be vaccinated, which was picked by AFRC. And also Christian Care from Zimbabwe picked an issue. Somebody was saying, why should they get a booster? It is of little importance because the people who have received the first dose are doing well. So these issues, which were picked by partners, with regards to enforcement, we had issues picked in 8 countries, and they were observation of non-compliance with health issues. This was had in 7 countries: Ethiopia, Kenya, Mozambique, Southern Sudan, Tanzania, Uganda, and Zimbabwe. And the issue of mask enforcement was had in South Africa. A few quotes from Zimbabwe by Christian Care. They say the general public is not reluctant to wear face masks, and the adherence to COVID-19 protocols is ignored. And from Kenya, which was picked by WHO, they say, forget namaste, fist or elbow bumping. The handshake is back, the masks are off, and the ubiquitous sanitizer has been forgotten. And finally, from Zimbabwe, there's a question: why is it that in European countries, people are watching football in stadiums and they are not even masking, while in Zimbabwe you get arrested for smoking cigarettes and you can't smoke while you have a mask? So these are some of the issues which were picked by our partners in the East and Southern Africa region, and we plead to partners to contribute to the feedback so that we have a wholesome picture of what's happening. Thank you. Back to you, Wayne.
Thanks very much, Tole. Well, we can see that there is misinformation out there, and that's exactly why a group like Viral Facts Africa needs to exist, which we will get to in a bit. But right now, I would like to introduce you to Antoinette Eleanor Ba. She is the East and Southern Africa Region Immunization Coordinator for UNICEF. Antoinette is a pediatrician and a master in tropical biomedical sciences. She has more than 20 years experience with international organizations and health ministries, formulating and implementing evidence-based policies with a focus on malaria, immunization, and child and maternal health care. Antoinette will talk to us about how Africa's COVID-19 situation compares globally, and specifically where we stand in East and Southern Africa in the race to vaccinate and strategies to get more jabs and arms in the region. Antoinette, welcome to the dialogues.
Thank you, Wayne. Good day, everyone. So happy to join this dialogue. And yeah, so let's have the first slide. I have a few ones to take you through addressing those issues that Wayne has mentioned. The next one. I will start with the COVID-19 situation where we are and where we are on vaccination, and zooming into our region. Next slide. Please, next one. So as of the country, the COVID-19 situation, as opposed to what maybe we can get here and there from the media and the other sources, we are not yet out of it. So if you just look at on this slide, the blue showing the blue shade, please stay there, yeah. The blue shade showing where we still have some cases. As you can see, the dark blues, meaning quite a number of cases are still there, and the other shades as well. But going through into details into the next slide by region. Next slide. Yeah, so of course, globally, we can see that the number of cases continue to reduce, except in the Western Pacific region, the down square there, where they are recording 47 million. And but overall, yeah, the last few months it's decreasing, but it does not say that there is 0 cases. It's still too early to say that the global situation is leading us to end of the pandemic. So that means that countries are still reporting cases, and therefore this requires response. Although the numbers are low, we still require response, including all the preventive measures. Next slide. Yeah. So where we are in terms of preventive measure, where are we with the COVID-19 vaccination? First of all, let's stop on the recommended strategies and the policies to achieve the global vaccination, the global target. So the WHO recommends that we start with vaccinating the older adults and the high-risk population. And that has, the aim is to reduce the mortality and the severe morbidity and hospitalization. Because we know that these groups, the older adult and high-risk populations, are the most vulnerable to severe disease. Once we reach good coverage of this target population, then as a second step, all adults can be vaccinated. And that will allow to resume more socioeconomic activities. Market can open, transportation, and so forth. And after that, once again reasonable good coverage is attained, then the third group, the adolescents, can be vaccinated, right? And this will allow to reduce the transmission and future risk, and then hopefully lead to a full recovery. So what the WHO recommends is that countries strive to vaccinate 70% of their population, because this will include the vast majority of those at risk of serious disease. Why this? What is the rationale for that? First of all, if the big chunk of the population is vaccinated, up to 70%, then this will provide substantial health return and investment through adult vaccination, right? And therefore, the disease burden will be reduced, and the transmission through adolescents also will be reduced. Because the adolescent, even though they don't necessarily express severe disease, they can transmit. So that will also reduce the risk for the vulnerable population to be infected by through contact by the adolescents. And then also aiming at vaccinating this number, 70% of the population, that will catalyze the political risk for at-risk investment. There is no 100% efficacious vaccine, but it is worth the effort for full recovery, economic and socioeconomic activities. And at the same time, by opening the services, medical services, to a wide range of the population of vaccination, not only children, as usually we do, it's strengthened the primary healthcare system. As I said earlier, the first step is to vaccinate the older adults and those who are at risk, such as the diabetic and so forth. So expanding the vaccination to this group will expand the reach, the access of this group to health services. And while they get their vaccine, they can also be checked and for their chronic conditions. So of course, as we speak, there is still scientific uncertainties, and that's why this scope and this strategy and policy is reviewed as and when we have more certainties on the scientific background. So where are we in terms of vaccination? Next slide. Yes. So in Africa, so this is the data from the WHO vaccination dashboard. So far, less than a quarter of the population in Africa have received at least one dose of any vaccine. And in terms of the population fully vaccinated, meaning having completed the primary series, we are just above 15%. So as you can see on this map, the red legend indicates the countries with less than 20% of the population vaccinated. As you can see, we still have a way to go in terms of vaccination to meet the target set and the recommendation set by the global policymakers to fully recover from this pandemic that has lasted 2 years. But we do have some good news, which is the countries in green. So in Eastern Southern Africa, we have 3 countries that are attain the bar of the 40% as of last month. These are Botswana, Mozambique, and Rwanda. And a few countries are heading toward that in yellow. They are between 20% and less than 40% of their population covered, South Africa and I believe Zimbabwe. Yes, so next slide. You can just keep clicking on the slides. It's not moving from my side. No, you have just the one before the thank you slide. So this is just to further elaborate on what I mentioned earlier, that we still have a way to go. And if this slide shows, if you wish, the level of effort, the coverage, the complete primary series of coverage across what we call the AMC participants, which are the participants that are supported by the global partnership through the COVAX, right? And again, you can see more than 40% is Mozambique, and the other countries you don't see. But most of them are in the reddish, oranges shade, meaning that they are between 1% coverage and 20% coverage. And I believe this is my last slide. Yes, so thank you, and looking forward to the discussion. Thank you.
Thank you very much, Antoinette. Totally, I believe we have some questions. Would you like to take that over and ask some of those questions to Antoinette?
Sure. Antoinette, we have questions. Ken Bosire from Kenya asks about the cause of the COVID-19 virus, and if there's any headway with regards to the origin, and also asks if we are going to see the end of the virus soon. And let me ask, because there are a number of questions, let me ask a couple. And also we have Tayo Banda from Zambia. Tayo asks, what is the lowest age recommended for a person to get the vaccine?
Can't hear Tole anymore. I don't know whether it is on my side or.
Sorry, I think I dropped. So Tayo from Zambia asks, what's the lowest age recommended for a person to get a vaccine, and what should be the highest?
I got this one, this too?
Yes. Others, there's still more to come.
Okay, so let me try and respond to this. When will be the end of the pandemic? I guess at this point nobody knows. The WHO is monitoring very closely the evolution of the pandemic, and specifically monitoring very closely the variant of the virus, right? We have all heard about the Delta, the Delta, the Omicron, and so forth, because this virus keeps changing, if you wish. And so we cannot say that unless we have a period where there is no cases at all, that the virus has disappeared. So just to reiterate again that we are far from anywhere close to saying the pandemic is over. So the message is really to continue the protection, and also to, fortunately for once, we have a vaccine that came out very early in the outbreak, and to make sure that those who are at risk of dying and of risk of being more severely ill, these are vaccinated. And again, and that takes me to the second question, the lowest age to get the vaccine and the highest. Before I go to the age, I will say about the conditions. So in terms of the conditions, all those with chronic disease are really more at risk of going to hospital, going to ICU, and even dying of that. So this is how the WHO has set the prioritization for vaccine. So depending on the condition. So these are the primary highest group. In that primary highest group is also those age of the elderly. So depending on the country, some countries are saying 60 and above, some I think even in other countries is 55 and above, depending on each country. So this is the two priority group. Now, how low can we go before a country goes into vaccinating youngest adult, below 55, adolescent and children? These groups that I mentioned earlier should be covered at close to 100% if possible. And once that is done, depending on the epidemiology of each country, the policymaker will consider going down to 18, some are going up to 12 years. So far, for the vaccine recommended by WHO, there is no vaccine that WHO is recommending below 12 years of age. But again, just to reiterate that before the youngest are vaccinated, it's recommended to protect the adults, the elderly, those with condition, and then the adolescent and the youngest to reduce the risk that they transmit the disease, because most of the time they are asymptomatic. Over.
Questions also. A couple more questions from Kenya. Angelina Mkabili and David Erika are asking, so Angelina is asking, how do you convince Kenyans that COVID-19 is still there when the government has rolled back preventative measures? And Erika on the same is asking, he deliver to the public now that the government has rolled back? What kind of content you?
Sorry, I think I did not get clearly the second question.
So David Erika is asking, what information should he deliver to the public, given that the government has rolled back all preventative measures, there's no masking and all?
I think alongside those measures, the government of Kenya is still pushing for and making all the efforts to increase the coverage through campaigns, multiplying the vaccination sites, and so forth. But again, regarding the measures that the control measures, probably we are not looking at it in totality, because what is said is in certain settings, masks are no longer mandatory. But when settings were still like indoor settings, where the ventilation is not appropriate, or physical distance cannot be maintained, then in those settings, masks are still still mandatory. So it's not all masks off everywhere, but again, depending on the certain settings. So it's good that probably we make sure that the public understands that there are situations where one still have to continue to use the preventive and hygiene measures, right? And including sanitation, good hygiene, and so forth. Yes, I guess the second question is also is related to the same. So really, the information to the public is to highlight and clarify that the approval of not using the mask depend on the settings that the public is. Over.
Thank you, Antoinette. We still have many questions for you and for Anne, but we will move on to the next presentations and then come back to the questions. Back to you, Wayne.
Thank you, Tole. Thank you, Antoinette. Yes, now we will welcome Anne Gingere, a social content editor at Viral Facts Africa, which recently celebrated its one-year anniversary. Viral Facts Africa is the public face of the Africa Infodemic Response Alliance, a network of trusted public health institutions and fact checkers who debunk misleading health claims. Anne is a journalist whose views on misinformation have been highlighted on Kenyan media, including NTV, Spice FM, TV47, and at events organized by the WHO, the Gates Foundation, and the Mozilla Foundation. She previously worked for Citizen Television in Kenya before joining PesaCheck, one of Africa's largest fact-checking organizations. Today, Anne will take us through how COVID-19 misinformation and disinformation is now spilling over to affect other diseases, and how fake info undermines public health efforts to fight outbreaks, not just of COVID-19, but also other the diseases while the fight against COVID continues. Welcome to the dialogues, Anne.
Thank you for having me. Let me share my screen now. Yeah. Yes, so thank you so much. As Wayne has said, Viral Facts Africa is an initiative that was launched in March of 2021 to address the health misinformation and the information gaps that we were seeing on social media for like the better part of 2020. So Viral Facts is hosted by the Africa Infodemic Response Alliance, which is an initiative of the WHO Regional Office in Africa. And it brings together public health institutions and fact checkers across the continent who have a footprint in 35 African countries to amplify and make scientific fact-based health information highly visual, engaging, and shareable across social media platforms. So we work with agencies like AFP, Africa Check, Dubawa, PesaCheck, who are fact checkers in different countries across the continent. And we also work mainly with WHO, Regional Office for Africa, but also we also collaborate with other institutions like UNICEF, the International Red Cross, just to get out to amplify accurate health information. Because in 2020, we saw like a flooding of inaccurate information, and became very overwhelming for people to know what is accurate and where can I get accurate information. And so one of the best ways to counter this was to collaborate with partners to ensure that the accurate information has a wider reach. So because most fact check content is usually written, like you write an article and publish it on a site, we realized there was a gap on social media where people are seeing all these things circulating on Twitter, on Facebook, but are not able to determine whether it is true or false. So viral facts content is mobile first. So we produce different kind of content, which is all visual and optimized for social sharing. So we keep our videos very short and straight to the point, because we want people to get all the information they need in a minute or less. So we have worked on misinformation literacy, where we tell people the things that they need to be on the lookout for when they are sent or see something on social media. Like, before you share it, these are the things that you need to consider so that you do not amplify misinformation inadvertently. We also do debunks, and this is where the fact-checking partners come in, where when they have fact-checked like a claim that is going viral in a country, we then pick that article and visualize it and pick the most important things, and then put it in a video and share it. We also do mythbusters like this one, where that are kind of conversation based, when people have, because we've seen a lot of misinformation, not just about COVID-19 vaccines, but also even about the preventative measures. Like now we've seen a couple of false information about masks. So we do something like this that is very short, that debunks the claim that you're seeing online. Yes, so in 2020, the misinformation trends that we were seeing were mostly about COVID cures, because no one knew, it was a novel disease, no one knew how it was transmitted or how you could prevent it. So there was a lot of misinformation around these things, and that's when we saw, people in some countries dying because they believed all the remedies that they were seeing on social media, and unfortunately with tragic outcomes, because they died. And also because of the overflow of information that was online, it was very difficult for people to know what was true and what was not true. So in 2021, because that is when most of the vaccine rollout campaigns started globally, and like in most African countries, that was from around March, which was around the time that Viral Facts was launching, the misinformation was about COVID-19 vaccines, and it was a lot. And this false information about the vaccine, so very many countries struggle with increasing vaccine hesitancy. And of course, this led to lagging vaccine rollouts. And if you saw in the news, there's some countries that actually had to destroy some of their vaccine stocks, because they had the vaccines, but people were not willing to go and get vaccinated. And when you spoke to most people, it's because they said, I saw this on social media, so I don't think I'm afraid to get vaccinated. So 2021, we spent a lot of time debunking a lot of misinformation about COVID-19 vaccines. So one of the things that we did was pre-bunking, which is where you address questions that you're seeing. There's an information gap online, or people are asking questions online. For example, would see people asking questions like, can I get pregnant? Can I get vaccinated if I'm pregnant? And you see, that gives you a chance to set the record straight before the actual misinformation starts circulating. So this is an example of one of the things that broke when the European Medicine Agency suspended for like 2 days the AstraZeneca vaccine. And of course, it was breaking news. And we jumped on this very quickly just to get the facts out. This is why this has happened. Because unfortunately, when you leave such an issue unaddressed, you will find that bad actors will come in and start spreading, you know, all these false claims, all these conspiracy theories, and then it becomes very difficult for you as a fact checker or as health agencies trying to get people vaccinated to now come and convince them that what they're seeing is false. So we adopted a pre-banking strategy where you address these gaps before the specific misinformation starts to thread. And this also requires you to have continuous ongoing social monitoring on social platforms just to see what conversations are people having, and which is a good thing because I've seen Internews is also doing that. So it's something like what Tole presented, where you just monitor and share what you're seeing and decide on the best way to approach this before you have the actual misinformation going around, and also to address people's concerns, because mostly it's questions that they have. And once you address this question, they have all the information that they need to make an accurate decision about their health. So we also asked people to send us questions using the hashtag VFA check, because we realized it's not that people were not willing to get vaccinated, they were just hesitant because they were not sure about some of these things, and they were being exposed to a lot of misinformation on social platforms. So we asked people to use the hashtag VFA check, hashtag Viral Facts Africa, and also to send us questions on DM. And we got a lot of those questions via private messaging. And we were able to now address these questions with videos like this, because people started asking, can I take alcohol if I have been vaccinated? Is it safe for me to take alcohol? Or should I take painkillers before I get vaccinated? Or is it safe to take them at all once I'm vaccinated? So we had to answer all these questions that people had just to make sure that everyone had the information that they needed. So now in 2022, as the previous two speakers have mentioned, we are seeing this false belief that COVID-19 is over. And unfortunately, this is because of the declining coverage of the COVID-19 pandemic. We are seeing a shift to coverage in, you know, like what is happening in the world right now. Russia, Ukraine, like in Kenya, we are right in the middle of election season. So there's a lot of political coverage, and we've seen declining coverage of COVID. So one of the assets we produced, I think I'll play this one. Yes, so I'm just sharing some of the things I pull out from the reports that the monitoring reports that we publish weekly. So another thing that we are seeing in 2022 is the spillover of COVID misinformation to other non-COVID related health issues. So for example, in February, the WHO Malawi reported a polio outbreak in their country. And now from there, we saw, all these concerns and all this misinformation as highlighted in the report that people were saying that it is another avenue for public health organizations to administer the COVID-19 vaccine to the populations. And also people saying that they do not understand why we need a mass vaccination campaign, yet it was only, one case of poliovirus. So this is how we have responded to these claims. We have published several items that just address the questions that we are seeing. And one of them was an interview with the country director, the WHO country director in Malawi, just explaining and breaking down to people why it was important to have a polio vaccination campaign and why it's important to get your children vaccinated. So I'll just play the 4 videos so that you can just get a grasp of how we respond to this.
The reason is very simple. Because we have identified the wild polio virus type 1, polio is a highly infectious disease, and the intent of the vaccination campaign is to very rapidly protect all children and get ahead of the virus. Polio is an infectious disease. In the worst case scenario, it can cause death. But as in the case of this child who now has permanent paralysis, this does have life-changing consequences for this child, for this family. And yet we know that we have time-tested tools to prevent children getting polio. Vaccines is right up there with exclusive breastfeeding as important child survival tools.
So this last one is just from pictures that were taken during the rollout when it began. It's a bit lengthy, so I'll just play part of it. Or before that, let me play the second one. I think it's, yeah. In February 2022, His Excellency the President of Malawi, Lazarus Chakwera, declared a polio outbreak in his country. Malawi is aiming to vaccinate 2.9 million children against polio in 4 ongoing vaccination rounds. As the vaccination program got started, Masi Uledi, a vaccinator trained by WHO, alerted her supervisor about the number of families refusing to get the polio vaccine in Namazoma village in Bulanji. I found families refusing to get their children vaccinated against polio for several reasons, and the main one was the confusion driven by the COVID-19 pandemic and the misinformation. Mothers in Namazoma shared common concerns. This could easily be a new drinkable COVID-19 vaccine that you want to administer to my child. How would I know? The district team traveled to meet the village chief, Nelly Chimeno, who immediately called the village's traditional leaders and caregivers using a homemade bill to debate the situation. Vaccine refusal was at 50%. 46 households had rejected the vaccine. With support from Elsie Chidetse from UNICEF Malawi and Fitwi Menes, a WHO stop transmission of polio consultant, District Health Promotion Officer Mr. Chipiriro Mjojo provided awareness in the local language of Chichewa to ensure a successful vaccination rollout in the community. It's critical for leaders to understand why this campaign is going on, so that the message can be easily trickled down to the community, as people will listen to their traditional leaders first, affirmed both Elsie and Fito. After a long debate, all the community's questions were addressed. There is no drinkable vaccine against COVID-19. This is the polio vaccine, and we are only administering it among children under 5 who are at risk of getting paralysis due to the polio virus. All we want is to protect our children. Leaders asked why children get a small mark in their fingers to prove their vaccination status. Why are you then marking every child with your hands? Mother Yes, so lastly, I think as journalists, we have to help our audiences. It is our responsibility to help audiences understand the facts around COVID-19 and around other health information that, as we are seeing now, it's coming up, and help them to make informed decisions. Because people do not refuse to, for example, get vaccinated because they do not want to. It is because they do not have all the facts, and they become hesitant to take these steps that would actually better their lives. So, and I also think that we can limit the impact on our audiences of harmful misinformation, which is spreading on social media. So yes, I think that's it from me. Thank you very much for listening.
Thank you, Anne. We have a lot of questions, so I'm going to hand over to Tole to get started.
Okay, here we go. So I'll do it in batches. We begin with questions for Anne. So Anne, you have Jean Gasasira from Rwanda asks, what are the means to combat misinformation and disinformation? And we have James Katoi from Kenya, who asks, how do we deal with COVID misinformation? And then we have Kayode Ankisla from Nigeria, who asks, how can we sanitize information dissemination? And Sharon from Cameroon asks if there's a way for perpetrators of disinformation to be traced. For Anna. For Antoinette, we have for Antoinette. We have quite a number of questions. Sharon from Cameroon is asking, Cameroon, they are not recommending the COVID-19 vaccine to pregnant women. She's wondering if the case is the same in other African countries. We have Kelvin from Malawi, who's asking about the low vaccine uptake now that the target is 70%. What danger does the low uptake pose in African countries? And how are African countries going to 20% target? And if rich countries are helping poor countries to get to that target? We have Gift Banda asking, why is there a low vaccine uptake in Africa and in some countries? Is it because of political influence? And also we have what measures, by Velma Udwori, what measures can be put in place to ensure people get vaccinated, considering the fact that countries like Kenya have eased on the containment measures? And there's also another question from Sharon asking Anne if Viral Facts Africa has a WhatsApp contact number that can be shared with the public. And also we have Wesley Langat asking if we can have multiple vaccinations, could this lead to vaccine hesitancy? And yeah, we have more, but let's deal with that first. Thank you.
Yeah, totally, if I can, there's just one point where your voice cut out, and it was a question for Anne, which I think is kind of interesting. Sharon again from Cameroon asking, can the perpetrators of disinformation be traced? And should criminal charges be brought against them once they are traced? So, okay. So Anne, we'll start with you.
Thank you. Tole, you moved a bit fast, so I missed some of those questions. But I'll start with the perpetrators question. What happens is, like, when you see something false, there's this third-party fact-checking program that fact checkers have with Facebook, where you then forward that false claim. What happens is that it is, especially if it's like about COVID-19, the post is taken down. But about criminal proceedings, I don't think we're there yet. But all I know is that social platforms are really trying to reduce the circulation of harmful COVID claims. And in cases where it's persistent, you have those accounts like flagged. So yes, and sometimes it is difficult for us to trace that misinformation, especially if it is circulating on WhatsApp, which we know is one of the most widely used platforms in Africa. So it is very difficult for you to know the origin of this and how widely it has circulated. So that is one of the challenges that we have as fact checkers. Yes. Then about a WhatsApp number for the public, we don't have that yet. So if like you have a claim that you would like us to check, for now we use Facebook, Twitter, and Instagram. You can send us a direct message there, and then we'll be able to have a conversation and maybe help you with whatever claim you would like to have checked. So Tole, could you please repeat the first two questions?
I think Tole may be offline again.
Okay.
In general, there are basically the questions were, what are the main measures you can use to combat mis and disinformation? Okay. How do you deal with COVID misinformation? Yeah, generally like that.
Yeah, so one of the measures that we've taken is, like I shared in my presentation, we have all these different kind of content formats that we use to put the accurate facts out there. So number one is, which has well for us, is a collaborative approach, because you've seen, I shared in my slides the kind of partners we are working with, and they have huge audiences and a lot of followers on their social platforms. So once we debunk or produce an explainer, we share these content with our partners, and they're then able to further disseminate on their platforms. And we've been able to reach hundreds of millions of people using this strategy. And it's also good because now we are able to also monitor what they put out and see what kind of conversations is it eliciting, and how do we need to respond to these conversations. And then number two, teaching people digital, promoting digital, because that is one of the main problems that we've seen is fueling the spread of misinformation, because people don't necessarily mean, have ill intentions. They just see this post on Facebook or on WhatsApp and they're like, oh my God, I have to share this with my friends or with my family. You just want to look out for your loved ones. But then it turns out what you're sharing is not accurate, yet you have amplified, and it just snowballs and just, becomes viral. And so one of the things that we are teaching people is the importance of just taking a minute to verify information before you share it with your networks, because that's the only way you can slow this down, by teaching people. Because unfortunately, as fact checkers, we cannot always be there 24/7 at people's points of consumption. So you need to empower people. These days, almost everyone has a smartphone. So you need to tell people, you see this on WhatsApp or you see this on Facebook, these are the things that you need to be on the lookout for before you just hit share and send. Can you first read an article just to make sure that the headline is not misleading, it is not sensational? Because we've seen cases where sensational headlines, just people reshare, retweet, and when you read the article for better context, the headline is totally misleading. So teaching people how to sift through information and determine, do I need to dig further before I share this with people, has been very important, because that's the only way that you can stop this whole thing going viral. Because unfortunately, when something goes viral as fact checkers and you debunk it, sometimes the accurate information does not have the same kind of impact that the misinformation had. So just teaching people how to verify information before they send it out is very, very important to combat misinformation.
Okay, thank you. Antoinette, do you want to answer the questions that were directed to you? I think you're on mute.
Sorry, yeah, no, I was saying just very quickly, we are, I think, to the hour. Yeah, but all the questions are basically coming back to this. We have a low coverage. What do we need to do to be protected if there is another wave? And actually, that's the thing. We cannot roll out at all that we'll get a fifth wave. The cases are reducing, but countries are still reporting and still having some cases in the hospital and so forth. And as we have seen also, another variant, new one cannot be rolled out. The Delta is still around, Omicron is still around, another one can come. So no one knows what is going to come. But what we have seen that once people get vaccinated, even when a variant is circulated, their risk of developing a severe disease and ending up to the hospital or even worse is reduced. So what we need to do is to continue to promote and support the vaccination acceptance, understanding, dispelling misinformation so that people go and get vaccinated. Now, one of the challenges that probably in our context in Africa and low mid-income countries is the fact that the resources may be for the immunization program to go and vaccinate so many people in such a short time, while they still have to vaccinate the children and so forth, that required a lot of resources that were not available at that time. But now what we can see is the global partnership is coming together to put out and make available resources through the WHO, through UNICEF, through other alliance partnership to avail resources for quick rollout of the vaccine. But this comes also to at the time where there is this kind of relaxation. So I think now that we have more resources to conduct vaccination campaign and even vaccination in health facility and more post for vaccination, there is even more than ever the need to dispel any misconception, misinformation, build again trust in the in vaccine in general, and not only in COVID-19 vaccine. We are not yet out of it, and we need to get to the 70% or so. And some countries are doing it, so we can do it. Just one more specific question was asked about the why pregnant women are not. Pregnant women are not vaccinated in some countries. While well, the WHO say that the risk of, the benefit of vaccinated pregnant women outweigh the risk. But again, the WHO says that each country has to look at their specific context, their own evidence to adapt the recommendation. So WHO provides a recommendation and guidance, and this has to be adapted to each country context. But in general, vaccinated pregnant women has more benefit than risk. And I think I think that's also touched to the question on the chat, whether we will have multiple vaccines. This is still research that is undergoing. Thank you.
Thank you very much. I know we're running a little over time, but there was a really, I think, a very good observation and question from Erica David. What can we do as journalists to ensure we encourage people to continue observing COVID regulations, since governments are lifting the wearing of masks requirement in public places, and people are thinking now, while coronavirus is over? I mean, I don't know if we have an answer for that. That is a difficult position for journalists to be in. They know the science, thanks to experts like you, and they want people to understand the science, but that's in some governments are saying, well, we've just decided that life goes back to normal, whether it's too soon to do that or not. And one last question, this is from Gift Banda to everyone. How are you going to empower media houses to help spread COVID facts? That could be for either of our guest speakers. That's a tough question to answer, I'm sure. Anyone care to take a try at that?
Yeah, maybe just share my perspective, and then Anne can certainly come in. I think just a platform like this one, it's something we are very much willing to contribute, participate, and help crafting the structuring the understanding, because it's also about having the information. Now, the expert in communication will tell you how to to do so. But, from the technical side, we are very much willing to and we do that to work with you, the journalists and the media experts. Over.
Thank you, Antoinette. I think that's a very interesting question. But one of the challenges that I've seen is with coverage of COVID-19 information is when a media house publishes a very sensational article or puts out a very sensational tweet, which is kind of clickbaity. So we're not quite sure if they're doing it to engagement, or it is because they actually do not understand. So like, for example, in Kenya, a leading media house put out a tweet sometime mid last year saying that a certain public figure, it was breaking news, has tested positive for COVID-19 despite being vaccinated, So that kind of puts out, you're left with question marks. Is it that they don't understand how the vaccines work, or what was happening? And now you have to come and put out an explainer on how COVID-19 vaccines work, because different vaccines work in different ways. But this is how COVID-19 vaccines work. They may not 100% protect you from maybe COVID infection, but of course, if you're exposed to the virus, they reduce your chances of getting severely ill or dying from COVID. So, but what was encouraging is that I saw very many people calling them out, and they eventually actually did an explainer themselves on how COVID-19 vaccines work. So I think striking the balance between putting out accurate information and not being sensational, because that is the main problem we've seen, where you put out a very sensational headline so that you have more traffic to your site. So yeah, I think the ball is in your court as the media. I think just putting out the accurate information, and not using the clickbaity headlines and not being sensational, especially when it comes to health information. I think how you tell the story is extremely important, because literally people's lives are at stake here. Health misinformation, we've seen people dying. So I think it's extremely important to tell things as they are and be as accurate as possible, and also speak to the experts. I think now with this, it's easier to have access specialists, technical people with technical expertise on these kinds of things, like Antoinette here, to break it down for you, so that because people rely on the media for these kinds of information. So you have a very huge responsibility to tell them everything accurately, then they can decide for themselves. Yeah.
Thank you both for your insightful answers. As we prepare to wrap up another media dialogue, we'll give you the contact info to access Viral Facts. We'll put that on the screen, and I'll just let you know that we'll be sending the recording of this dialogue to everyone who joined us today, and we'll send audio excerpts of today's speakers to our full journalist network via WhatsApp to make sure everyone gets the latest data on the pandemic. As always, we want to hear from you, the journalists, about how you use this information. Please send us your work so we can track how useful these dialogues are to you, and also tell us any topics that you'd like us to tackle in future dialogues. Many thanks to Antoinette Ba and Anne Ngere for joining us today. And until next time, for Tole Nyata and the RCCE Media Working Group, I'm Wayne Sharp, saying thanks for joining us and stay safe.
Thanks for having us. Thank you so much.
Bye.
Thank you very much.